Ginger is one of the healthiest and most nutrient-dense foods on the planet and has been used for centuries in both traditional medicine and regular cooking. So what is ginger good for? Well, today we will take a deep dive into 9 incredible health benefits of ginger, which is backed by scientific evidence. And to make things even better, we will also share some simple tips on how to include more ginger into your daily routine. So stay tuned. At No. 9, we have that ginger can reduce nausea. Ginger is well known for its antiemetic properties, meaning that it can be used to alleviate nausea. Ginger has been used for this purpose for hundreds of years, especially for nausea related to motion sickness, pregnancy, and post-surgery. A review published in the Journal of Alternative and Complementary Medicine found that ginger was effective at reducing nausea and vomiting in people undergoing chemotherapy. Another study showed that ginger was effective at relieving nausea and vomiting after surgery when consumed as a tea or a supplement. In addition, ginger is thought to help relieve nausea associated with other conditions such as migraines and vertigo. Though more research is needed to fully understand the benefits of ginger for these conditions, ginger's antiemetic properties make it an attractive option for those looking for natural ways to reduce nausea and vomiting. Before we move on, please take a moment to subscribe to the channel. If you're new here, it really helps us to keep going. Now back to the video. At No. 8, we have that ginger can aid digestion. Ginger is a common ingredient in many digestive bitters, which are used to stimulate digestion before a meal. This is because ginger has a long history of use as a treatment for digestive issues such as indigestion, bloating, and gas. Gingerol is thought to be the active ingredient in ginger that gives it these properties. Gingerol is a bioactive compound found in ginger that is responsible for many of its health benefits. When consumed, gingerol is thought to stimulate the production of digestive enzymes and bile, which helps break down food and aids in digestion. In addition, gingerol is thought to relax the smooth muscles in the digestive tract, which can help relieve symptoms of indigestion, bloating, and gas. Moving on to number 7, we have that ginger can help prevent certain types of cancer. While more research is needed, some test tube studies suggest that ginger may play a role in preventing the growth and spread of cancer cells. One study published in the journal Anti-Cancer Agents in Medicinal Chemistry found that ginger extract inhibited the growth of human prostate cancer cells. Another study found that ginger extract was able to suppress the growth of breast cancer cells. These studies suggest that ginger may have anti-cancer properties and could potentially be used as a complementary therapy for certain types of cancer. However, it is important to note that more research is needed to confirm these findings and to determine the optimal dose and form of ginger to use. At No. 6, we have that ginger can improve brain function. Ginger has neuroprotective properties, meaning that it can help protect the brain from damage caused by oxidative stress and inflammation. Several test tube studies have shown that ginger extract can help improve memory and learning in animals with Alzheimer's disease. In one study, for example, rats with Alzheimer's disease were given ginger extract for 4 weeks. At the end of the study, the rats in the ginger group had improved spatial memory compared to the control group. Another study found that ginger extract was able to protect neurons from damage caused by beta amyloid, a protein that accumulates in the brains of people with Alzheimer's disease. While more research is needed to fully understand the benefits of ginger for brain health, these studies suggest that ginger may be a promising complementary therapy for neurodegenerative diseases like Alzheimer's disease. Next up at No. 5, we have that ginger can lower blood sugar levels. Several studies have investigated the effects of ginger on blood sugar levels, with some showing that ginger may help lower blood sugar levels, while others have found no significant effects. A study published in the Journal of Diabetes and Its Complications, for example, found that ginger powder supplementation significantly reduced fasting blood glucose levels in people with type 2 diabetes. However, another study found no significant effects of ginger on blood sugar levels in people with type 2 diabetes. Despite these conflicting results, the evidence that ginger may help lower blood sugar levels is promising and warrants further investigation. At No. 4, we have that ginger can reduce menstrual pain. Menstrual pain, also known as dysmenorrhea, is a common condition that affects people who have periods. The pain is caused by contractions of the uterus and can often be relieved by over-the-counter pain medications, such as non-steroidal anti-inflammatory drugs, NSAIDs. However, some people are looking for natural alternatives to these medications. Ginger has been used for centuries to treat various types of pain and inflammation. So it's not surprising that it has also been studied for its potential to relieve menstrual pain. In fact, a study published in the journal Pain found that ginger powder was effective at reducing menstrual pain when taken orally. Another study found that a ginger extract applied topically was effective at reducing menstrual pain and improving menstrual blood flow. These studies suggest that ginger may be a promising natural alternative for relieving menstrual pain. However, more research is needed to confirm these findings and to determine the optimal dose and form of ginger to use. Moving on to No. 3, we have that ginger can relieve osteoarthritis pain. Osteoarthritis is a common type of arthritis that causes pain, stiffness, and inflammation in the joints. It is the most common type of arthritis, and it affects millions of people worldwide. People with osteoarthritis often experience pain and discomfort, which can impact their quality of life. Over-the-counter pain relievers, such as NSAIDs, are often recommended to help alleviate symptoms. However, some people are seeking natural alternatives to these medications. Ginger has anti-inflammatory properties that have been studied for their potential to relieve pain and inflammation. Several studies have investigated the effects of ginger on osteoarthritis pain, with some showing that ginger may help relieve pain and inflammation. One study published in the journal Clinical Rheumatology found that a combination of ginger and turmeric was effective at reducing knee pain and improving physical function in people with osteoarthritis. Another study found that ginger extract was able to reduce markers of inflammation in people with osteoarthritis. These studies suggest that ginger may be a promising complementary therapy for osteoarthritis pain. However, more research is needed to confirm these findings and to determine the optimal dose and form of ginger to use. Next up at No. 2, we have that ginger can lower cholesterol levels. High cholesterol is a common problem that can increase the risk of heart disease and other health problems. Many people choose to take medications to help lower their cholesterol levels, but some people are interested in exploring natural alternatives. Ginger has been traditionally used for various health purposes, including lowering cholesterol levels. Several studies have investigated the effects of ginger on cholesterol levels, with some showing that ginger may help lower total cholesterol and LDL bad cholesterol levels. For example, a study published in the Journal of Alternative and Complementary Medicine found that ginger powder supplementation significantly reduced total cholesterol and LDL levels in people with high cholesterol. Another study found that ginger extract was able to reduce total cholesterol and triglyceride levels in people with metabolic syndrome. While more research is needed to confirm these findings, the evidence that ginger may help lower cholesterol levels is promising and warrants further investigation. And finally, at No. 1, we have that ginger can reduce inflammation. Inflammation is a natural process that occurs in the body in response to injury or infection. However, chronic inflammation has been linked to a variety of health problems, including heart disease, cancer, and diabetes. Ginger has anti-inflammatory properties that have been studied for their potential to reduce inflammation in the body. Several studies have investigated the effects of ginger on inflammatory markers, with some showing that ginger may help reduce levels of pro-inflammatory cytokines such as tumor necrosis factor alpha and interleukin-6. For example, a study published in the Journal of Pharmacy and Pharmacology found that Ginger extract was able to reduce levels of inflammatory markers in people with rheumatoid arthritis. Another study found that ginger powder supplementation significantly reduced C-reactive protein, a marker of inflammation in the body, in people with coronary artery disease. While more research is needed to confirm these findings, the evidence that ginger may help reduce inflammation is promising and warrants further investigation. Thank you for watching. See you in the next video.